Hi, good morning, Rudy.
Hi, good morning.
And can you give me a little idea of your past experience with English before you came to Trinidad?
Okay. I came to Trinidad in 2010 to 2012 to work with the Cuban batch as a registered nurse. I am an ICU nurse and hemodialysis nurse. Before coming to Trinidad, we were taught English in Cuba, but it was like basic English. Once we came to Trinidad, it was a big challenge to all the Cuban staff because we had to interact with the local people in the street, with the patient in the hospital, and the language that they speak in Trinidad is very different that we taught in Cuba, right? But once you start interacting with the patient, we get accustomed. Even though it was really hard, but I think the Cubans we did very well, and we survived speaking the Creole Trinidadian language, right? I have a lot of experience about the language because when you are, for example, you must speak English in Trinidad because they don't understand your Spanish. So once you are in the grocery, once you are in any place, in the hospitals, in the bus, traveling, whatever, the people speak in the Creole, the broken English, and you have to understand. Was very funny at the beginning because I used to speak proper English and now I'm willing to speak a little bit of Creole. When I meet my friends, I say "Wapen gal, wapen boy." So we got the accent and we got the pronunciation right. So about the culture, I like Trini culture. It's very interesting. Many things were new to us. How the people have different beliefs. Some people are they believe they are like Catholic or Presbyterian. A lot of Muslim people in Trinidad that we are not accustomed. Nursing council has some rules that were difficult to Cubans. For example, some male nurses don't supposed to examine female patients. So it's not allowed because the religion, and in Cuba is different. It was very different. We can examine female or male patients.
Right.
Even we have male nurses working in the gynecological hospitals.
Yes.
So it's different in Trinidad. But I think we got accustomed and we respect your rules, right?
Right.
We didn't come here to change anything. We came here to respect the rules and work for Trinidadian hospital and patients who need our help.
Right.
About the food, most of the Cuban professionals, we didn't like spicy food before coming to Trinidad. Now, after 1 or 2 years, people like food. I mean, Cuban people, you see the Cubans in the street eating doubles and eating spicy food. But I don't like spicy food. Sometimes I like a little bit spicy, but some Cubans put a lot of spicy in
How
there.
do they say a little bit of spicy in Trinidad? How do they ask you how much pepper you want? What do they say?
You want light? Slight or strong or whatever.
Yes. And,
Yes.
what are some of the language features that you learned? What are some of the ways in which people spoke that you were surprised about? Like asking people.
Yes, for example, one of the times I was waiting for a taxi, and I asked the taxi driver, okay, are you going to Coquimbo Repo? So Mira go there, Mira go there, Mira go there. So I'm not going there.
Yes.
I said, what is Mira go there? So I learned that Mira go there is I'm not going there.
And how do you ask people their age? What you were telling me about today.
Oh yes, I was in the hospital working one of the nights with the local nurse, an Indian nurse, and she was asking the patient some personal information. And when she was to ask the patient how old was the patient, she said, "How many years you have?" And the patient said, "Yes, I have 34 years." So it's very interesting because you get accustomed hearing the pronunciation, and you like getting in yourself, and you speak like them sometimes. Even though I try to avoid speaking like them, sometimes I can't help.
Yes, but tell me what the surgeon asked the patient after the
So
surgery.
one of the days I was working in ICU, and the patient had the surgery the day before, and the doctor came in the morning to ask the patient if she had any bowel movements. So he asked the patient, okay, did you break any wind? I understood. Did you break any window? And it wasn't like this. It was, you break any wind? It was if the patient like was passing
Gas, yeah.
gases or whatever. So I think it has been a big challenge. Also because of the culture. Trinidad is one of the Caribbean islands and has a lot of drugs.
Yes.
We don't have drugs in Cuba. We don't have gunshot in Cuba.
But do you see these things on the wards?
Yes, I have seen that mainly in casualty. When you're
Yes.
working in casualty, You get a lot of patients who have been involved in accident in the highway because they speed a lot, or they consume drugs, or they have been attacked or robbed. And it's very difficult to us. The level, the security you have in the hospitals in Cuba, the doors are open. In Trinidad, you have the security in the door, so it has been very, difficult to Cubans getting accustomed to that.
How did you get accustomed to that? How did you get accustomed seeing all that blood and gunshot wounds and all of that?
Well, once you are interacting with the same, the same day, the same problems every day that you see people consuming drugs and coming to casualty, and people drunk, so you getting accustomed to deal with the patient. No like we feel afraid we can go out later in the night because we can be attacked or robbed. So.
But you still like it? Do you still like it?
I like it, but I don't take the risk. I don't going out in the night. They think white people has money.
Yes.
And they, like a target. They think every time I walk on the street, the migrants, they're asking for money, and I can't stop. I have to go on because it's dangerous.
And what Creole have you learned? How do you speak? Do you speak the Creole? And how do you feel about it? How do you feel about speaking it? Is it difficult to speak?
Well, I'm willing more to understand the Creole than speaking instead, because yes, I know. Even the Trini music, I like the Trini music also. The song says "Ame bacanal," I am a bacanal. It's really funny. The music use a lot of Creole language.
Mm-hmm.
Every time the patient asks me, "Okay, where are you from?" I tell them very serious. I said, "I'm trained to the bone." I said, "What?" I said, "No, you're not trained to the bone." I said, "Why do you say I'm not trained to the bone?" Because of your accent. I said, "Okay, I'm trying, but I know I'm from Cuba." So. Yes.
But you told me this morning that it's easier to speak Creole instead of speaking standard English sometimes in the streets and in the hospitals.
Yes.
Like what? What?
Yes. I think it's easy for Cubans sometimes when we come into Trinidad. We know how to respect grammar rules. We can say, "Where was you?" and instead, "Where were you?" Or "How many years you have?" and instead, "How old are you?" Or "Where you was yesterday?" People will understand, and instead, "Where were you yesterday?" So in that case, it's very easy. They understand me, what I say, or I understand what they say, they tell me. And I think it has been funny, a little bit funny, yes.
But what recommendations would you make? Because I know you spent 2 weeks here learning English for 6 hours.
Yes, before the recommendations, when I went back to Cuba as a holiday, I have a lot of English teachers, they are my friends in Cuba, right? They taught me a lot of English. And I came back to Cuba speaking Trini language and say, what you say? I didn't teach you that. Why are you speaking like this? Why are you speaking broken English? So because that's how you speak in Trinidad. So I tell them, okay, I speak 3 languages now. I speak Spanish, I speak English, and I speak Creole. I speak Trini. This is like another language. You have to get accustomed.
It is.
Well, some of my recommendations, for example, I think the CLL did very well in bringing Cubans here and training the Cubans for a month or month and a half in English, practicing English. But it will be nice if, for example, Center for Language Learning, they bring some local doctors and local nurses, because we will be most of the time working in the hospitals. So even we learn the Trini language in the street, we need to learn about the Trini language in the hospital, right? What kind of question the doctor asks to the patient or the nurse asks to the patient in the health field, to learn more about that. You can bring some local nurses and we can interact with her, and she will explain to Cubans what are the common diseases the patient coming from to the hospital. So it will be nice that if we bring some local doctors or local nurses to interact with them, and they will teach us how to speak with the patient in the hospital, right? The patient who is admitted, the patient who needs your cares in the hospital, because that's our reason for being here. That's the main reason, to give a good attention to the patient, a good care to the patient. That's the main reason.
Anything
and
else?
I think that Cuban health system has one of the best standards in all over this.
Oh, yes.
Cuban professionals, we study hard, and we try to do our best all over the countries we are going to help in the health system.
Right, and you were telling me earlier about the pacemaker that that your dad is getting?
Yes, right now, my daddy today, I have to call to Cuba at 11 o'clock in the morning because my daddy got sick last week. He needs a pacemaker because his heart isn't working properly. He got sick last week and he's getting the pacemaker for free today in Cuba. So
How is that different?
it's very different here when you see the people that they came sick to the hospital. The patient have to wait a long time for any CT scan or any test because they don't have money to afford in the private hospital. It's very difficult for Cuba to get across because in Cuba the health system is free. I feel sorry for many patients who can afford paying that amount of money for a CT scan, for an ICU bed, which is about $10,050. So it's also it's a challenge in Trinidad. The difference between Cuba and all other countries, I mean.
But you're happy here?
I am happy here, yes. I have a lot of friends, Trinity friends. They have helped me a lot, and I really appreciate how teachers in that school taught me English, and I also appreciate how some friends have helped me a lot in Trinidad for the time I have been here, I mean.
Thanks, Rudy.